So I am a physician, and in the course of my work, had spent time working abroad in sub-Saharan Africa and really saw that there were huge health needs, and that while many doctors or nurses and folks would fly in and potentially deliver care and leave, there wasn't really a legacy. There wasn't skills being transferred. There wasn't a handover of information that was really investing in these countries, and felt that that needed to change. Also, because there was a huge demand to be involved in something structured and to be able to give back in global health here in this country. And so we created something called Seed Global Health, which partners with the U.S. Peace Corps to send doctors and nurses abroad to be medical and nursing educators for 1 year. They work as local faculty. They live very much like their local counterparts, and they spend the year teaching, training, and helping to build a new generation of doctors and nurses who are highly skilled, capable of not only delivering outstanding care, but being able to teach. Last year, we taught 2,800 people in over 32,000 work hours, and we taught over 85 new skills, courses, and other educational efforts. These volunteers are extraordinary. You know, I mean, I could rather tell you about them than sort of talk about what we've done. But one of our volunteers, Maureen, within 5 hours of being at her site, got a knock on the door and was called to the operating room emergently. She saw a pregnant woman on a table dying because she had a ruptured uterus because she'd been in labor for 3 days in her local village.
Oh my gosh.
She had 5 children, and the baby she'd carrying had already died. And Maureen realized she had the opportunity to save this woman's life, and she performed an emergency hysterectomy. So this woman, she not only changed the course of life for this one woman who will now go home to her 5 children, ensure that they grow up with a mother, are more likely now to continue school, less likely to fall into poverty when they're older. But she also changed the course of women and pregnant women in northern Tanzania, where 1 woman dies every hour from a complication of childbirth or pregnancy. So these are the people that we're sending over, because Maureen taught all of her colleagues how to perform the surgery and when and why. And that's a really extraordinary gift that she's been able to do. And so our hope is that as we send more Maureens over, we have 42 volunteers in the field this year, we can begin to have a bigger impact over time, and we can finally break down these 2 standards of healthcare that we see existing in the world.